Reason number one is a pretty common complaint amongst denture patients, and that is general discomfort. Dentures have a plastic feel to them. They don't feel natural like your normal teeth. This is especially common complaint for people who get the top row of their teeth replaced with a regular denture. I have an example with me here. The upper denture has a much larger surface area than the lower denture. The additional space of the upper denture helps keep it in place, but the texture of the material can be annoying to many people. So when patients get dentures for the first time, they have an adjustment period to go through. On top of this, dentures don't just stay in place and function perfectly. You have to get something known as denture paste that helps keep the prosthesis in place throughout the day. The paste is applied right here in the groove where it would sit on top of your gums. As you can imagine, the combination of the plastic and the denture paste can be difficult to live with. It really takes some getting used to, and many patients never make the full adjustment into total comfort. Okay, so on to the next one. Reason number two is a lack of functionality. This relates back to what we previously spoke about and how dentures don't just stay in place by themselves. The only thing holding regular dentures in place is the adhesive that you place on the inside and the natural suction that occurs from the dental fit itself. This can be sufficient throughout the day when you're just talking to people or sitting at work typing away. However, it becomes problematic when you want to eat. Obviously, teeth play a big role in helping us eat food. And as you know, teeth are securely fastened to the jaw through roots. Regular dentures don't have those roots. So when you're going to bite on something like an apple, a piece of steak, or some chicken, it becomes difficult to effectively chew food. This is why most regular denture patients are forced to eat soft foods like soup, or if they try to eat meat, they have to cut it into tiny pieces. Imagine having to deal with that for years on end. It's not the most pleasant experience. And this takes us to the final reason, and this one is by far the biggest drawbacks of regular dentures. Reason number three is bone recession. Most people are unaware of this, but our bones were designed to have opposing forces pressed down upon them. What do I mean by that? Well, I have an example here with me of a past patient. When you're missing one or multiple teeth, the jawbones in that area begin to recede. As you can see from this person's x-ray, this person's jawbone has receded a ton over the last 10 years. Here's why this happens. In order to maintain a thick and healthy jaw structure, we have to have the opposing forces pressing against each other. That pressure, in combination with the tooth roots, prevent the bone from receding and give us our natural facial structure. That's why many denture patients will have their face start to sink in over time. As their bones continue to thin out, they start to develop wrinkles in their face. And their dentures actually have to be replaced after a few years because the structure of their mouth has changed so much. If you're thinking about getting regular dentures, make sure you take all these factors into consideration. Dentures are a great temporary option if you just want to look better aesthetically, but over time, they'll have some real drawbacks. I hope this video helped you. If you found this video to be helpful, please like and share it with your friends. They might appreciate hearing this information as well. My name is Dr. Justin Scott with Pure Dental Health. Have a great day.